colleagues from KMPDU, my brother Waziri Simon Shalugut, members of the Fourth Estate. First of all, Karibuni, you're most welcome to the Ministry of Health. Today is a happy day, and I'm pleased, like everybody else, and I'm sure Kenyans will be excited as we head for Christmas, that we all together present them with the gift of good health care during this period. I would like to take this opportunity to really thank the officials of KMPDU, the doctors who are here with us. I want to say a special thank you to you gentlemen because of the way that you have conducted yourselves, the way that you have consistently not only represented yourselves but the union, but also represented Kenyans and the Ministry of Health at large. I feel that I want to thank you because throughout this whole process, we have not once gone into personal or personalities or personal issues. It's been agreeing to disagree on very respectful, in a very respectful manner, and on issues-based, an issues-based discussion, an issues-based debate, never personalized at any time. So I want to thank you for that. I want to thank my brother, the CS for Labor and Social Protection, Simon Shelgui, because of the assistance he has consistently given to all of us and the way that he has handled his ministry with consistency, with dedication, and the way that he has patiently dealt with us and as we have gone through this discussion. So what I would like to do now is to give an opportunity to Mr. Chibanzi to speak, and then I will ask the CS to read through what we have agreed so that everybody is in the picture.
I think welcome to this process, and as CS Kagwe has said and mentioned, we have been engaging continuously, and even where we've had disagreements, it's mainly been on the issues and the welfare and safety and of our people. That is the doctors of this country who treat Kenyans. And first to thank the President himself, His Excellency Uhuru Kenyatta, for his intervention in this matter. And secondly, also thank the CSs, CS Chelgui and CS Kagwe, and also to thank Governor James Ongwae for his intervention and his understanding and in his efforts to resolve this matter. And then lastly, to thank the two health committees of Parliament, that is the Senate and the National Assembly, for their intervention, efforts and mediation, and given direction on these matters that still affect us, not just as doctors, because we are still part of this country. And our main aim is that those who are taking care of all Kenyans are comfortable and are secured and assured of their compensation, treatment, and safety and health. So this process today is part of the journey to try and address the matters that are affecting our doctors. We had initiated an industrial action on Monday, following a notice on the 16th of November, which was suspended for 14 days. And then we have come to the following conclusion, that the following matters will be addressed. Through the Ministry of Labor, there was a standing committee, multi-agency standing committee, to resolve the grievances of all healthcare workers, not just the doctors. Today we are signing an agreement in which the National Treasury will be required to fast-track funding for counties to procure a comprehensive group life, last expense, enhanced work injury benefits, and group personal accident cover as provided for by NHIF, and also ensure that our members get comprehensive cover from the counties, that is procurement, through the counties, the ministry and SRC and Treasury to fast track payment of call allowances or to the doctors at the Ministry of Health and public universities. Office of the CS here, both CSs, the Labor and Health, to aid in mediation of the labor disputes in Laikipia and Kirinyaga counties. And then the ministry is working around to look at the contracts of the 116 doctors who work in isolation and treatment centers for their continued engagement, because COVID is still with us and they're still required on the ground. Also consider the contract terms of the 206 doctors working at the Kenyatta National Hospital. And lastly, that PPEs shall be provided to our members in all public facilities. This is a recommendation that the parliamentary health committees had also given, and the CS, we are sure he's committed to that. He will ensure that PPEs are available for all our doctors to serve Kenyans, and there'll be no victimization of any member of KMPDU and all our members who have undertaken this action. But also to say that we do have outstanding labor disputes in various counties across the country, and the commitment that we have gotten from the CS Labor and the CS Health is that they will take it upon themselves to intervene. We have outstanding counties that have taken a tangent that is not healthy, not just for the doctors, but even for the public. Mombasa is one of the counties, Migori is another county, Nyamira is another county, and many other counties that still have pending disputes. There shall be efforts to mediate and restore normalcy and provision of services. So I think today being the 24th, I know that we are all now geared up for the festive season and the holidays. I think as Kenyans, doctors will provide services for you in the facilities, and we continue to engage, and we do hope that come January we shall have this type of engagements to ensure that during this period of the pandemic, all our doctors are assured of their safety, occupational health and safety. And with that note, I would like to declare that the strike by Kenya Medical Practitioners, Pharmacists and Dentists Union has now been called off. We shall continue further engagements to follow up on all other matters that we had raised in the strike notice dated 16th of November. And that is our hope, that we shall all come together to resolve these matters. Thank you.
Thank you very much. I'll invite Waziri to also make his remarks.
Thank you, CS. Thank you, CS. Mutai Gagwe, CS in charge of health. And also I want to thank Dr. Chipansi Mwanjonda, the Acting Secretary General for Kenya Medical Practitioners and Pharmacists and Dentists Union, KMPDU, and the entire leadership, including the chair of this union. And also first to thank the CS for his leadership, stewardship of this ministry, and the engagements they have had with the union. Now, following the notice that we received from this union almost a month ago, I immediately swung into actions and communicated with my counterpart in the Ministry of Health. And after that, we constituted a multi-agency team. That team included my ministry chairing and conciliating, and we had the Ministry of Health represented at the highest level. We had the Ministry of Public Service Commission, Attorney General's Office, the National Treasury, all participated. And we involved also our social partners, Central Organization of Trade Union, which is the umbrella body, and also Federation of Kenya Employers. We also brought in Council of Governors in the table. And we started conciliating and scoping the issues. And we had a number of issues that were listed on the table by the union. And as a ministry, our mandate is to conciliate employer and employees. We were able to address and bring out to the attention of respective ministries and departments who are able to, item by item, provide or give guidance on each item. It is now my pleasure and hope my pleasure, and I'm also happy and excited that ultimately we have turned the corner as Kenyans. We've risen to the occasion, to the expectations of Kenyans, more so on the eve of Christmas. This is the best Christmas gift that we can give to our people, Kenyans. So I thank the doctors, I thank the Ministry of Health, and that we are committed as Kenyans all the time to come to the table. I want to appeal to medical doctors, medical workers, and any other Kenyan worker that the government of Kenya, the Ministry of Labor, is always open for conciliation. Come to the table. We will facilitate engagement, productive engagement between employers and employees. I now want to read the resolution.
I think he has gone through.
He has gone through. I just say that in summary, we have arrived at a return to work formula, and that all the issues that were raised and itemized have either been addressed or we have given assurance of action, and that me and the Minister for Health will facilitate engagement with any county government or any other department in government to ensure that this return to work formula is sustained. So we want to conclude that and wish all of us a Merry Christmas and a Happy New Year, and that going forward we will have the standing committee, the standing multi-agency team will continue in place, will continue conciliating and addressing any outstanding issue to ensure